Good evening, Bermuda. I can confirm that currently 2 potential COVID-19 outbreaks concerning workplaces are actively being assessed and managed based on established protocols. Contact tracing is underway and public health guidance has been provided. More details will be provided to you, the members of the public, as they become available. A lot of misinformation has been occupying social media all weekend concerning our school systems and recent cases. 2 of the recent cases have close contacts with children in our school system. Principals and staff of the schools have been informed and instructions provided consistent with public health guidelines. Testing is also being arranged with these schools, as was the case with Saltus Grammar School, where some 240 students, parents, teachers, and grandparents were all tested over the weekend. Students in the said classes, as well as their teachers, are required to quarantine for 14 days. Siblings of these children who are unable to live separately from their sibling who's being quarantined are also asked to quarantine. This is only if they are unable to quarantine, albeit living in the same household. We are acting out of an abundance of caution. Please note that just because persons have been asked to quarantine, this does not mean that they are carrying the virus. The person may have had a potential exposure to someone who is currently being assessed. This is a very important distinction. We are actively assessing the close contacts for symptoms and awaiting test results. I have full confidence in our epidemiology and surveillance and testing teams to evaluate the extent of any outbreak and to ensure that it is contained. We are in control of this situation, Bermuda, and are following a well laid out plan to combat any possible outbreak. As Minister of Health, I want to reassure the public that the uptick in positive cases that we are seeing was expected as we see a surge or a second wave in cases in countries such as the United States and the United Kingdom. My team at the Ministry of Health have been working diligently all weekend, following a well laid out plan to combat and assess any possible outbreak. Again, this includes contact tracing. If you have not been contacted by a member of the team, please do not rely on rumor or social media to determine your next steps. If you are in fact a close contact, you will be contacted by the Department of Health. In addition, I would like to take this opportunity to once again remind the public that the Ministry of Health will contact you only if you have been identified as a close contact and need further instructions to be quarantined or to get tested. Otherwise, I continue to urge everyone to wear their mask, wash their hands, avoid closed spaces, crowded places, and close contact settings. Also, please note that just because persons are quarantined, like I said, this does not mean that they are carrying the virus. As a reminder, the difference between quarantine and isolation is as follows. Quarantine and self-quarantine is used to prevent the possible spread of a communicable disease. Quarantine and self-quarantine mean that a person with no symptoms must stay in their home or accommodation and must stay 2 meters or 6 feet away from others. Isolation, on the other hand, is for persons that have symptoms, including fever and cough. Isolated people must stay at home or in a hospital if they're critically ill and have limited contact with others. To clarify, when a person is quarantined and they do not have symptoms, but they are separated from others, and when a person is isolated, that means that they do have symptoms and must be kept away from others. Both of these public health measures are used to prevent the spread of infectious diseases. Acting out of an abundance of caution, preemptive measures are being taken at the schools where close contacts have been identified. To be clear, the Ministry of Health guidelines for schools in this situation state that if you live in a home with a child that attends the same school as a close contact and has a sibling, but the siblings can properly separate in the home, then they should do so. If not, then they should also quarantine. And I must also reiterate the established workplace guidance. Management should send home any employee who has any of the symptoms following: cough, shortness of breath or difficulty breathing, chill, repeated shaking with chills, muscle pain, headache, sore throat, loss of taste, or smell, diarrhea, feeling feverish or a measured temperature greater than or equal to 100.4 degrees Fahrenheit, and or having close contact with a person who has tested positive. There will be a cabinet COVID subcommittee meeting tomorrow where we will have further discussions about these issues and other issues, and we will report to the public as need be shortly thereafter. Thank you.